السلام عليكم ورحمة الله وبركاته. دكتور محمود فوده استشاري علاج تطبيقي في مستشفى الملك فيصل التخصصي، زميلي الدكتور محمد الشهري. I'm very proud that I gave this lecture before Mohammed, because Dr. Muhammad covered a very, very important topic. As you see, pain is not as easy as we think. It's very complicated, a lot of things together, and you have to solve them all together to reach your point. It's not only the morphine, of course, it's a very important part, it's the principal part, but there's a lot of issues around you to solve to reach your solution. I was asked actually to give this presentation in the second day, tomorrow, and I was reading the program, your program today, and I saw that today she is presenting some cultural aspect about pain, which is very important. So I tried to take it out from my talk, and then we have a lot of friends who are having about pathophysiology, Dr. Bukhari about as well about the assisted treatment, Dr. Sahib. So I was at the end tomorrow planning to do summary or to do something different. As long as I came today, I have to make some modification. Shall we speak in Arabic or in English? Who wants us to speak in Arabic? Please raise his hand. So you need some Arabic, at least we can translate some of the words in Arabic. شيء يعني على الأقل some of the items will be in Arabic. And of course, we have to continue in English. You want it in English? We will make both. We'll not continue. So, all right. How many physicians we have around? Physicians, please. Yes, so thank you. Nursing staff, the majority as usual, and the others, other specialties, of course. Thank you very much. So the pain in palliative care patient, that's what the topic, principle of pain in palliative care patient. They asked me to talk about the pain in palliative care patient. Pain is pain. Pain, any patient who having an another disease should have pain. Why in palliative care maybe have special precaution, special aspects of palliative care? That's why I have to choose. Pain definition, as you see, that is a sensory and emotional experience. It's not only sensation, it's not only physical. Emotional experience sometimes is more important than the physical one. But the definition is broader than I think. I think it's a complex experience, embracing physical, mental, behavioral process, comprising the quality of life. And somebody says it's enough to say pain, whatever the patient say, it hurts. Just ask the patient, are you having pain? He will say, yes, that's it. He has pain. So simple as that. So we have to respect the patient and see the pain once the patient says it hurts. So physical pain is only one aspect of the human suffering, okay, which is called total pain, human suffering. Suffering is a disturbance in the interconnected aspect of the self or personhood. We, as a person, insan, shakhs, we are a collection of what? Physical, social, spiritual, and psychological aspects all together, making us our personality as a person. So, the depth of each one affected us. If the psychological problem is hurting us, is main more than it will take most of the pain. Is the spiritual aspects of suffering making our world more painful, or is the main reason for the pain? This is a lady, and as you see, called Cicely Saunders. She's the founder of the modern palliative care in our ages. So the pain, as Dr. Shiri showed it nicely, very good. So pain, something called total pain, which is in the middle. It is a social, this is German, it seems that. So yeah, there's a social dimension, there's spiritual dimension, psychological dimension, and physical dimension. This is called total pain, البين الكلي, الوجع الكلي. So total pain, when you reach total pain, suffering, is destroyed meaning. Dr. Shiri showed this very nicely. The meaning, معنى في الحياة. You lose this meaning. When you lose the meaning, you are suffering. As well as when you lose hope. When you have advanced cancer and think you're going to die, there is nothing in the horizon, so there is no hope, so you are destroyed. This is by itself is a suffering. So it's pain. Okay? And this is an example of pain. Is this boy suffering or not? You can imagine the picture. What is this boy having? Huh? Okay. So, palliative care. What's palliative care? There's a lot of definition actually. I'll give you a simple in one sentence. Palliative care is minimizing suffering and improving quality of life to all patients actually. It's not only the cancer patient. It's the principle of palliative care. Minimize suffering and improving quality of life. Simple as that. Okay, that's what we are doing. That's our specialty. We are specialized in advanced cases in cancer and other advanced diseases, but this is the principle of palliative care. From here, before you go to sleep, let's go to a story, simple story, to show you what is palliative care, what we are doing, what is the patient facing. So this is a real life scenario. Okay? So we'll go to the story. Our patient is Mr. Javid Ahmed. He's a 52-year-old patient. Arabic speaking, understand that. Huh? Admitted in a year of a late February, in a month of February, okay, for investigation of an 8 kilogram weight loss and back pain. مريض دخل المستشفى شهرين ألم وناقص في الوزن. Okay. Scanning and needle biopsy revealed adenocarcinoma of the head of pancreas. Okay. His diagnosis simply showed advanced cancer pancreas. سرطان البنكرياس متقدم. في الحالات هذه, in these cases, surgery is the option. But in his patient, no surgery. Okay, it's not fit for surgery. So what to do next? ايش العمل؟ عنده سرطان متقدم في البنكرياس. الجراحة is not an option. So what to do next? Next is multi-thing. If you want to go to the oncology center, he will give you this offer. هقول لك نديله chemotherapy and possible surgery, or combination of chemotherapy, أو chemotherapy مختلط, أو single agent chemotherapy, أو chemotherapy في الأول بعدين نشوف إذا كان في جراحة, or we have to give him radiotherapy, or radiotherapy in the beginning and towards the end, or they give him this option, palliative care. So when you have many options in life, it means there's no good option. If there is a good option, when you have appendicitis, so they have one solution is appendectomy. So if you have many solutions in medicine, it means there's no right option. So this patient who was offered this, they told him about, this is what we have, but there is no cure. This is the harm, this is the benefit of each aspect. What do you want? In the West, they are frank, they are with their patient. They say, I want palliative care. Let's see, did the right choose or not? Choose or not. For the last 30 years, cancer pancreas and advanced pancreas has no treatment. The therapeutic options modality, whatever you give him, patient lives from 6 to 12 months or 9 months maximum. So whatever, here or if the stays or not. So this is the background of this. So decision. This patient, after a discussion with the available therapeutic options, okay, burdens, expectation, benefits, شاف كل طريقة مين أحسن, فهي choose the palliative care. If you want to go to the palliative care, you have to look, as Dr. Shiri told you, about a lot of aspects about cultural, social, and family history. It's very important. So let's see what is this social and family history of this patient. You have to go to the background. Mr. Javid's family includes his wife. He has a wife, عنده زوجة, 3 children, 2 daughters and 1 son. Okay? 2 daughters and 1 son. Our patient was born in Pakistan. He's a Pakistani. Have lived in Canada for 25 years. This story is happening in Canada. He lived 25 years. Lot of people with their family abroad and they live there and they share their family. Mr. J is a teacher. He teaches a community college and his wife works in retailing clothing business. Both he and his wife are working. The oldest children, Yasmin, his oldest daughter, and Ahmed are at university. Daughter Sarah is in grade 11. Yasmin will graduate with her engineering degree in May. Look at that. Our patient diagnosed in February. His daughter, eldest daughter, will be graduated after 3 months in May. Is that important or not? So that's why we talk of social, okay? Social history of the patient and family history. The family are proud of her and looking forward to this event. All the family waiting for the eldest child to be graduated. Okay? Now, let's get the reality. We have to face the واقع. Psychological impact, isn't it? A patient, Abu al-Aila, the head of the family, is having incurable cancer, and he might die within 6 or 7 months, because in the West they are telling him the prognosis. So it's not an easy for the family to face this. It's a big shock. So it's a psychological impact reacting to the bad news. When you have this news, of course you have to react bad. You'll be in a shock. So how the family receive that? Although Mr. Javid and his wife has been worried about something bad, of course they know there is something serious, there is something bad. هم في مشكلة. The diagnosis of cancer with no effective treatment available comes as a great shock and sadness to them. That's normal. Shock and sadness. If anybody faces this problem, you will have this problem. They ask that, typical, like our people, a Muslim man or a Turkish part of the world, they ask that their children not to be told about the illness. إحنا لما يجي واحد مرة يقول لك don't tell my children because they're mad, don't my mother. You know, typical. They ask the doctors not to tell the diagnosis to the children, as it would be too upsetting for them and at time when they need concentration in their studies. لو عندهم امتحانات، عندهم مذاكرة، عندهم كلية، please don't tell them the diagnosis. Is that right or wrong, you think? To tell our children or not to tell? To tell? To tell? Tell? Not to tell? No? Who said yes? Tell our children. 1, 2, 3, 4, 5, 6. Who said no? Oh, so this man is right. He's from our culture. We'll see, is that right or wrong? Okay? Maybe you are both right, but we'll see. So response, what is the healthcare team in Canada responding to this? لما قال لهم don't tell my children. هم رأيهم ايه? What's their opinion in Canada? The team members, the palliative care team members, are concerned about their request and explain to Mr. and Mrs. Javid why this is not a wise or kind or a path of action, even though it may seem to be to the result. They told them, we know that you want to protect your children, but we think as a team is not the right way. So they don't say yes or no, they give them opinion, okay? And they told them, okay, please think of it. So the couple, Mr. and Mrs. Javid, said, okay, we'll think more about revealing the diagnosis, هنفكر في الموضوع, وبعدين يمكن نقول للأولاد of their children. And the team identifies this as something needing follow-up. They said no, they should have to follow up on this point because they are concerned about the children, the team as well. So, what is the aim of treatment in palliative care phase? As the Sheikh put it to you, first of all, short goals is symptom management. We have to relieve the symptoms of the patient. The patient is having cancer, pancreas, سرطان pancreas, لكن عنده what? He's presenting with pain. So if you are not going to treat the cancer, you have to treat the pain, which is the patient suffering. So active symptoms control, pain relief, and other symptoms available. This is the short goal of the team. They transfuse the blood for him because they found he was having low hemoglobin and he was general fatigue. And the blood is only given to relieve symptom and the improve general condition of the patient. That's why the indication in palliative care. And they said, we'll discharge Mr. Javid as soon as he feels it to go. Okay, he stayed 3 days in the hospital, 5 days. When you are ready to go home, to prepare your family, we'll send you home. This is how they approached his disease. What about the family? Okay, he said he and his wife together, having some time to reflect, of course, we have to think, to say, and at home, Mr. and Mrs. J decided to take their children. They are convinced now that they have to take the children. They took the decision. Okay, about his illness. The children reaction to that. What is the children? They want what the children want. Ask to meet with the physician. They want to meet with the physician. عاوزين يشوفوا الدكتور. And the social worker to discuss some question they have. They have the right. They want to ask some question. They want to know what will happen to their father. They want to know if their father is going to die or not. They will not ask the father. Yeah, they might ask the physician. They want to ask the father, is our father going to suffer or not? Is our father going to have pain or not? How can we help our father? So they have right to know. And they want to ask the question to the concerned people. Okay, so we know that the patient is having pain. So after approach pain assessment is the most important thing in pain management. If you don't approach the assess pain, you will not treat pain. Our colleague, inshallah, Muhammad, will tell you about how to assess pain. Then opioid initiation, according to the WHO level, it needs some titration, as he said. It's not easy. You can go up to your opioids till you reach a satisfactory pain control according to some certain rules. It's not as simple as that, as you think. Okay? Pain was under control with what? Sustained release morphine. Morphine is slow release. 100 milligram BO, 8 hourly. After titration, we find this dose of morphine is enough to control at the present time his pain. 100 milligram of morphine 3 times a day, long acting. Besides the breakthrough analgesia Dr. Sher told you about, which is necessary, is about should be immediate release morphine every 2 hours if needed. This is the pain management to this single patient at this time. Of course, other symptoms like nausea and vomiting, it might exist. They give us some called haloperidol for nausea and vomiting, and of course, stimulant, because we know all opioids can cause constipation, and we have to add routinely to most of the patient stimulant, laxatives, laxatives. So we'll continue the story. Over the next 10 weeks, 2.5 months, after 2.5 months, we were in February, you remember. 2.5 months, it will come near May. Mr. Javid is seen every 2 to 3 weeks. He comes to the outpatient clinic, to the palliative care clinic every 2 to 3 weeks. Always with his wife and sometimes with his children, of course. Okay? So what they do in these visits to the hospital? The appointments are usually 1 hour. It's not 5 minutes or 10 minutes. This is a big problem. This is not only for symptoms, it's a social, psychological, spiritual, all this aspect. Our patient in the palliative care, we need at least 1 hour or at least 3/4 of 1 hour to solve all this problem. It's not like the other clinics you go and visit to do a treatment. Because you are facing a lot of things. You are facing a family. You are facing the progression of disease. You are facing children. You are facing psychology. You are so at least this in Canada needs 1 hour to sit with the patient and his family. So for what? To adjust medication, because medication should be adjusted. It's not only one-time treatment. This morphine will reach higher doses and higher to control his pain. Okay? And physical and emotional and spiritual support to the patient and family. Okay? The physician, not only the physician in the clinic, there is a nurse, clinician, social worker, spiritual advisor are all involved to this patient. And we are very lucky actually in this setting to have our Sheikh, our proud spiritual advisor, Sheikh Fawzi with us here. He will talk to you about spirituality and this important thing. And we have an experience with him at King Faisal, and he was a big support to our program. And now, luckily enough, he is in the other hospital, military hospital, doing the same thing. So, we started 100 milligrams 3 times a day, and as Dr. Shea told you, the patient will progress and the need of morphine and opioid analgesia will increase. So it's not wrong. So this patient, by time, to control his increasing pain, the patient needed big amounts of moderate to severe medication. because he needed a bulk of BO medication. The maximum morphine medication tablet is 100 milligram. This patient might need 1,000 milligram at this stage, which means 10 tablets 3 times a day. He can't tolerate it. He has a cancer pancreas, he has discomfort, he has nausea, so we can't give him all this medication by mouth, which is the ideal way of analgesia. So what to do at this stage? You have to switch him to continuous infusion pump, portable pump, patients, okay, pain control analgesia. Simple. You see this pump? Small pump like 200 something. So you can put it here and you connect it to the skin subcutaneously and you can give all your medication at home. Okay? So over time, dose of morphine is raised to 30 milligram per hour. 30 milligram per hour through the pump. Okay? What that means? It's equal to what? It's equal to 2,000 milligram morphine. So we reach to this patient 2,000 milligram of morphine, PO, through the pump. Of course, we have to give him the PTA, breakthrough analgesia. Each injection is 30 milligram as he needed every 2 hours, with look out to the pump. They make certain adjustment to the pump. It will give continuous morphine infusion, like the infusion. In addition, the breakthrough, the patient will press on the some button and he will receive 30 milligram each time, every 1 or 2 hours. It's programmed like that. So always under control. It's not as, you see, it's complicated or sophisticated as you think. We are using it at one stage in our institution to our patients who are at home. So we are using some sort of similar pumps in our patients at one stage. So what is the patient wishes? What does the patient want? مريض عاوز ايش? Treatment plan and goal. It's always dynamic. It's not only one stage. مع الزمن بتتغير. What I want now, I want to build a house. I want to go to an over of the world. I want to be rich. I want a car. At one stage, when I'm good sick and I'm going to die, all I need rahmatullah subhanahu wa ta'ala. I need the iman. I need the rida. I need to أطمن على أولادي. So our wishes is evolving, changing. So okay. So what is the wish and the goal at this stage for this patient? Mr. Javid decides he does not want CPR or aggressive life support. He said, you know what CPR? Cardiopulmonary resuscitation. Okay? If the patient dies, suddenly you have to resuscitate him to resuscitate the heart. At advanced cancer, we don't do that because it does not benefit the patient. But it should be applied to the patient. He said, I don't want that. If I'm going to die, let me die peacefully. So he rejected that. Okay? However, he said, it doesn't mean that you don't resuscitate me, let me die. If anything will help me to live a few months to attend the graduation of my daughter, please do help me. Like antibiotics, pain management, all this stuff. Okay? So what are the main wish and goal and hope for this family? Mr. Javid major goal and source of focus become attending his daughter's graduation. All his hope now, he wants to attend the graduation of his daughter. I think we as a fathers, this is what we believe as well. If I'm in the same situation, I'll ask for that, I'll wait for that. This will become my hope. So if they concentrate, he wants to attend the graduation. How come? So the whole family shared in this event. Yasmin, the ceremony is near now. Yasmin and Ahmed college friends arranged to assist in his last body. He became very weak. So their daughters, his daughter and his son, they will, and their colleagues, they helped him to transfer him to the ceremony. And the close friends were invited at this event. So we are now in May. Here we are. Okay. The graduation was a splendid event to him. Mr. Javid present to watch his daughter's degree being conferred and also attend a reception at the family home. The family has many photos and videos. This is what he wants. he knows you're not going to be cured. I want my daughter to, I see my daughter graduated. So he was helped by the team, by the society, by his family to attend that. He's satisfied. So usually we face our process best together. You said, don't tell children. No, we have to tell our children. Our children should share us. We have all together to solve our problem. The wife, the children. Okay, also all together, our sadness and our good things should be solved together. Over time, the family share their sadness. You have to share your sadness together, as well as their fears, as well as their love, and even there is a humor together. This is what makes the family strength. Share everything with your family, okay? And this is their strength. Now, time goes, near the end. Look at this very important thing. The healthcare team in Canada, what they ask the family? They ask the family, inquires the family regarding Muslim faith. What you are Muslim want us to do to help you? In these details, let's say we not want Hawaj, Ra'su ila Qibla. You know that, we do that. They ask them, what is your faith? You want to worship? You don't need a lady to touch you after death. So it's in our culture. So they wrote that, and they respected it. So Canada. So these things, we have not to forget these things in our patients as well. Okay? Sense of inner peace. Did we have peace? I'm going to die. I am going to die 2 months. Can I have peace? Of course you can have peace. إذا في إيمان بالله سبحانه وتعالى في القدر, and you did everything. So this is the peace with the self. Now only 2 slides about spirituality, because here is, I can't talk while Sheikh Fawzi is here, but I'll give you 1 slide about what is spirituality, religions, and faith. Only 3 slides. Okay? Spirituality means is the aspect of a humanity, الإنسانية. معنى من معنى الإنسانية refers to the way individuals seek, express meaning. What is المعنى في الحياة? How to express it, okay? Purpose, إيه الهدف من الحياة? Okay, and they experience their connection to the moment. What is your experience with this time? Okay, and the self, مع الناس, مع نفسك. Okay, this is the spirituality, and to the creator as well, مع الخالق. This is in general spirituality. It's different a little bit from religious ديانة. هنشوف إحنا في الإسلام how can deal with this. Religions mean ديانة is the belief and worship of a super controlling power, a God. تعبد الله سبحانه وتعالى. Okay? في الإسلام, in our religion, belief, worship and law. اعتقاد وإيمان وممارسة وقانون عندنا الديانة الله سبحانه وتعالى. One God to worship, إله واحد. Okay? One God to obey, إله واحد تطيعه and follow. الإيمان بقى, الfaith, في القول and saying, endorsement, in belief in heart, and act in life, العمل في الحياة. ده الإيمان. So spirituality, religious, and faith. So you have to differentiate between them. Okay. Now, spirituality, you can imagine whatever you want. For Muslims, إحنا, spirituality for Muslims, real happiness and peace can be found in submitting to the commands of the Creator, sustainer of this world. God said in His Holy Quran, truly, in remembering God, God do hearts find rest. ما معناه؟ الذين آمنوا وتطمئن قلوبهم بذكر الله, ألا بذكر الله تطمئن القلوب. Do we need that or not at this stage? Do we need this faith or not? Okay? So Mr. Javid receives spiritual or religious support from Muslim community, of course, friends around there, and from reciting from the Holy Quran. Okay, got the picture. Shortly, therefore, Mr. Javid begins to lose his strength. Of course, disease is progressing, spending his time in bed near the window, looking over the backyard garden. Okay? He speaks of his sense of peace and calm. He is in peace. He's in calm. He's happy. He's not afraid. He's justifying what he wants. His religious, his family, his graduation. Okay? He declines further ibuprofen. He said, I don't need any further more treatment active. Okay? I want to stay at home. All right? I'll skip one of these of yours. Okay, what happened? One day, the end will come. Early one morning, the physician receives an urgent call from Mrs. J. So look at that. Early morning, there is somebody ready to receive the call in palliative care, in home health care. Sorry, I don't teach it. Okay. She said that her husband is suddenly having chest pain and a lot of trouble breathing. That's what the doctor. جوزها عنده a lot of chest pain, he can't breathe. So the doctor came to her, to her house. At home, the physician diagnoses what? Acute respiratory event, likely pulmonary embolism, most likely, clinical. Okay? Severe air hunger. He can't take breath. Air hunger. تخيل واحد عنده air hunger. It's more difficult than pain. Dyspnea or air hunger or suffocation is more distressing than pain. Okay? And Mr. Cyanotic asthma. Respiratory rate 48, tachycardia. So this is the situation he found. What to do? If you want, as a physician, you want there and find a patient like that at home. What to do? إسعاف وعلى المستشفى. Is that true? Till you wait to take him by إسعاف and wait and go to the ER and مش عارف 2-3 hours this patient will die from suffering. We'll see how they will approach you to this patient. Look, the family doesn't want the patient to go to the hospital according to his wish. He doesn't want to go to the hospital. And you have to respect that. Okay? So what the doctor says, what the doctor says? The physician administers 2 extra doses of 40 milligrams of morphine, doctor. Even at this stage of the respiratory tachycardia, the only treatment for this stage is more morphine. Against all the thinking of our colleagues and physicians, I know. When the patient is listening, they stop morphine. Am I right? So you have to give him another extra 2 doses of morphine, another extra dose of flurazepam to relieve him. Okay? And something called scopolamine, forget about it. Comfort at the last hours. With these 2 extra doses of morphine, and the infusion was increased. He reached to 3,000 milligrams of morphine at this stage. And this is an extra, what he is taking, by the way. Okay? In addition to the infusion through the pump. Mr. Javid gradually relaxes and lapses. بدأ يهدى شوي into sleep. بدأ ينام شوي ويصحى شوي. Decrease distress, ما فيش distress. And because this is imminent, عارفين إنه خلاص النهاية قربت. النيرس, the kind nurse, as all our kind nurses, she opted to stay with him. It's a shame to leave the patient dying and leave him in the hospital. So she stayed with him. Okay? Over the next hour, حصل ايه في اللحظات الأخيرة؟ في half an hour or 1 hour. Mr. Javid rests quietly, خلاص بقى الحمد لله مرتاح. Okay? Opening his eyes from time to time. شوي يفتح عينه شوي يسكر عينه. Squeezing his wife's hand. بتضغط عليه مراته بجنبه. Okay? The family around. Ahmed, the eldest son, was reading quietly from the Quran. Ahmed بيقرأ القرآن. And father repeating after him shahada. What do you want more than this? Family around you, your wife is with her, بيقرأ على القرآن, بتقول peacefully, مش في ICU, مش في الدرب, مش في ER, مش على الطريق. We have to think of these things. We have to think really. Our approach to our dying patient is wrong. Okay. Now the breathing is 20%, the patient is okay, everything is better, and what do you expect? A few hours later, our patient dies peacefully at home with his family and his son. Okay? Is it enough? Who will suffer now? The patient died. Family will suffer. This is what called the grief. الحزن ما بعد الموت. Bereavement. We have to support the family. We have to take care of the family. There's a bereavement team in palliative care. People who look after the family after the death of their beloved. You have to support them. So this is what's called grief or bereavement. What does grief or bereavement? It's dealing, coping, reacting to the event. This is a true picture, but not Javid family. I took it from other family. This mother, this young lady, the daughter of this eldest lady, who lost her husband and her son. And this old lady controlling her daughter. This is what the grief is. I want you to give a picture. Okay. And this is, we know where is it. Yeah, which place. Okay. So, is the story finished? Here's our window now, but without our patient. The physician retains, look at that, how people respect the family. The physician retains to pronounce the death and to spend some time with the family in support and saying goodbye. You have been the doctor for this man for 6 months. You have to tell them bye-bye. You have to say thank you. Isn't it? It's not just say bye and leave them and go. And the most important is, look at this. In accordance with this, his faith, like, what do you want to do us for your patient Muslim? Okay, Mr. Javid's body was treated as per Islamic tradition, request, and conveyed to the mosque before afternoon praying time in Canada. They did that for him. Okay. The physician and the healthcare team confirmed the plan to see the family after that. They told me, if you need us, please don't hesitate to call us. If you need anything for the family support. So, we conclude now. We finish our story. This gentleman is a 52-year-old. Is having advanced incurable cancer pancreas. Prognosis 4 to 6 months, we know that. Left his home in Pakistan at the age of 27. Lived with his family in Canada for 25 years. We knew him in the last 4 months. This is story only in the last 4 months of his life. Spent all his precious time of life at home surrounded by his family. This is 4 months is the most important months in life. He didn't spend them in the ICUs or in hospital. He spent them with his family around him, at home. Fulfilled his last wishes and goals, like what? Graduation of his daughter. He achieved that. He witnessed that. That's what he wanted. Okay, control of physical symptoms, simple confusion. What we do? Only drugs and small pump. And all his symptoms were under control at home. Simply. What about the interdisciplinary team? The physician, the nurse, the social worker, the spiritual advisors, they were doing a great job together. Palliative care is not only one person, it's a multidisciplinary. So this is what is palliative care is. Now I can give you the real definition of palliative care. What you hear in the story is the palliative care. It's a comprehensive approach to treating serious illness like cancer, focuses on physical, psychological, spiritual, existential needs. It goes to achieve the best quality of life available to the patient, to relieve suffering and to control other symptoms. And this is what we call what to see the person in the patient. Patient is not an object, he's a person. And when you approach him not only with X-rays or modalities or this, which is very important. Look at the person and the patient, see him as a human being. Thank you very much.